Let me paint you a picture. You're 68 years old. You've been taking magnesium for about 6 months because your neighbor swore it helped her sleep. And honestly, you felt better. Less leg cramping at night, easier bowel movements, maybe even a calmer mood. So you keep taking it every morning, right alongside the other pills your doctor prescribed for your blood pressure, your heart rhythm, and that thyroid issue you've had for years. Then one afternoon, you stand up from your recliner and the room tilts. Your heart feels like it's fluttering in your chest. You sit back down, scared, wondering what just happened. You go to the emergency room. The doctor runs labs and looks at you with that tight expression that doctors get when something is off. Your magnesium level is dangerously high. Your heart rhythm is irregular. And the medication you've trusted for decades is suddenly the suspect. That story plays out more often than the medical system likes to admit. And the science behind it deserves a serious conversation. My name is Dr. Lee Wei, and this channel is dedicated to one thing: helping adults over 60 understand what the research actually says about their health in plain language. And what I'm about to share with you today is something that most family doctors will never bring up in a 15-minute appointment, because magnesium is sold over the counter. It's marketed as natural and safe, and most people don't even think to mention it when their doctor asks what medications they're taking. But here's the truth. Magnesium is a powerful mineral. It controls your heart rhythm, your blood pressure, your nerve signals, and your muscle function. And when it interacts with certain prescription medications after the age of 60, the consequences can be serious, sometimes life-threatening, and almost always preventable if you simply know what to watch for. Today, I'm walking you through 3 specific medications you should never casually combine with magnesium supplements after 60. I'll tell you why the chemistry matters, I'll share what I've seen happen to real patients, and at the end, I'll give you a simple set of questions to bring to your doctor that could change everything about how you manage your medication routine. Stay with me through all 3, because medication number 2 is one that millions of older adults take every single day, and almost none of them have been warned. And medication number 3 is a quiet danger that most people have never even heard discussed until something goes wrong. Before we get into this, I'd love to hear from you. Where are you watching from today? Drop your city or country in the comments. I read every single one, and it really helps me see who's part of this community. All right, let's get started. Before we get into the 3 medications, I need to give you one concept, because without it, nothing I'm about to explain will fully click. I call it the kidney clock. When you're 35 or 45, your kidneys are powerhouses. They filter your blood, they regulate your minerals, and they flush out anything your body doesn't need with remarkable efficiency. If you take a little extra magnesium, your kidneys handle it. No big deal. But here's what changes after 60. 3 things specifically. First, kidney function naturally declines with age. Even in healthy older adults, the kidneys filter blood about 30 to 40% less efficiently than they did at 30. That means minerals like magnesium hang around in your bloodstream longer. Second, the medications older adults commonly take, especially for blood pressure and heart conditions, often affect how your kidneys handle minerals. Some of them cause your body to hold on to magnesium when it should be letting go. Third, the small intestine becomes more permeable with age. That means your body actually absorbs a higher percentage of the magnesium you swallow. So the same 400 milligram pill that barely registered in your 40s can deliver a much bigger dose to your bloodstream at 70. Put those 3 things together, and you have a perfect setup for magnesium accumulation. And when magnesium accumulates in the bloodstream, especially alongside certain medications, it can slow your heart, drop your blood pressure, weaken your muscles, and in serious cases, stop your heart entirely. That's the kidney clock. Keep it in mind as we go through each medication. Before we begin, take a second and tell me your name and where you're tuning in from. I go through the comments, and I genuinely want to know who I'm speaking to and supporting here. Medication. Number 1, calcium channel blockers for blood pressure. Let me tell you about Margaret. Margaret was 71 years old, a retired school teacher from Ohio. She'd been on a calcium channel blocker called amlodipine for nearly a decade for her high blood pressure. It worked beautifully. Her readings were stable, she felt good, and she never had a problem. Then her chiropractor mentioned that magnesium might help with the muscle tightness she sometimes felt in her shoulders. Margaret bought a bottle of magnesium glycinate at the pharmacy and started taking 500 milligrams every night before bed. She didn't tell her doctor. Why would she? It was just a vitamin. Within 3 weeks, Margaret started feeling lightheaded when she stood up. Her ankles were puffier than usual. She felt strangely tired, like her legs were heavy. One morning, her daughter found her sitting on the kitchen floor, having nearly passed out trying to make coffee. At the hospital, her blood pressure was dangerously low. Her heart rate had slowed to a crawl. Her magnesium level was elevated. The combination of the amlodipine and the magnesium had quietly amplified each other, lowering her blood pressure to a point her body couldn't handle. Here's the chemistry behind it. Calcium channel blockers, drugs like amlodipine, diltiazem, verapamil, and nifedipine work by relaxing the muscles in your blood vessels. They do this by blocking calcium from entering certain cells. Magnesium happens to do something very similar. It also relaxes blood vessels and slows the electrical signals in the heart. Take both at the same time, and you're essentially doubling up on the same biological effect. Your blood pressure can drop too low. Your heart can slow too much. And in older adults whose cardiovascular systems are already running close to the edge, that combination can cause fainting, falls, and dangerous heart rhythm changes. Calcium channel blockers are among the most prescribed medications in adults over 60. If you're taking one for high blood pressure, angina, or a heart rhythm condition, you need to know that adding even a moderate magnesium supplement is not a neutral decision. It changes your physiology in real, measurable ways. What to do instead? If you're on a calcium channel blocker and you've been told you might benefit from magnesium, do not start a supplement without talking to your doctor. A simple blood test can show your current magnesium level. In many cases, dietary magnesium from foods like spinach, pumpkin seeds, almonds, and black beans is more than enough, and it doesn't carry the same risk of overshooting because your body absorbs it gradually. Medication. Number 2, diuretics, especially the potassium-sparing kind. This one catches more people off guard than any other because diuretics are everywhere. Millions of older adults take them daily for blood pressure, heart failure, and fluid retention. And the relationship between diuretics and magnesium is genuinely confusing, even for some physicians. Here's the situation. There are 2 main categories of diuretics that matter for this conversation. The first is loop diuretics and thiazide diuretics. These are drugs like furosemide, hydrochlorothiazide, and chlorthalidone. They cause your body to flush out water, sodium, and minerals, including magnesium. Many people on these medications are actually low in magnesium and might genuinely need a supplement. The second category is potassium-sparing diuretics. These are drugs like spironolactone, eplerenone, amiloride, and triamterene. These work very differently. They cause your body to hold on to potassium, and as a side effect, they often cause your body to hold on to magnesium too. If you're on a potassium-sparing diuretic and you start taking magnesium supplements without testing, you can quietly build up dangerous levels of magnesium in your bloodstream over weeks or months. Consider a case like Howard's. Howard was 74, a retired postal worker from Michigan. He'd been on spironolactone for heart failure for about 2 years. His wife heard a podcast about how magnesium supports heart health, so she bought him a bottle and added it to his pill organizer. For a few months, nothing seemed wrong. Then Howard started feeling weaker. His muscles felt rubbery. He had trouble climbing the stairs he'd climbed every day of his life. At a routine appointment, his doctor noticed his reflexes were unusually sluggish. Blood work revealed his magnesium was significantly elevated, and his heart rhythm was showing changes that concerned the cardiologist. He was hospitalized for monitoring. The magnesium was discontinued, and over several days, his levels normalized, and his strength returned. What makes this particularly tricky is that the symptoms of high magnesium look a lot like aging: muscle weakness, fatigue, slowed reflexes, low blood pressure, mild confusion. A lot of older adults and their families assume these are just signs of getting older. They aren't always. Sometimes they're signs of a mineral imbalance hiding in plain sight. What to do instead? If you're on any diuretic, the very first step before adding magnesium is a blood test. Specifically, you want a serum magnesium level and ideally a comprehensive metabolic panel that also shows your potassium and kidney function. Once your doctor sees those numbers, the right path becomes obvious. Sometimes magnesium is needed. Sometimes it's the worst possible choice. You cannot guess from symptoms alone. If you're still here with me and finding this helpful, take a moment to type the number 2 in the comments. It lets me know you're watching and getting value from this. Medication. Number 3, certain heart rhythm and digoxin type medications. This is the one almost nobody is talking about, and based on what the research shows, it's one of the most quietly consequential. Digoxin is an old medication, but it's still prescribed today, especially for atrial fibrillation and certain types of heart failure. It works by strengthening the heart's contractions and slowing down certain abnormal rhythms. It's effective, but it has a very narrow safety window. The dose that helps and the dose that harms are uncomfortably close together. Magnesium has a complicated relationship with digoxin. Low magnesium makes digoxin more toxic. High magnesium can interfere with how digoxin works in the body. And here's what really matters. Your magnesium level can fluctuate based on diet, hydration, kidney function, other medications, and yes, supplements. If you're taking digoxin and you start swinging your magnesium levels up and down with random over-the-counter supplements, you can push yourself into either dangerous territory without warning. Beyond digoxin, there are also antiarrhythmic medications used to control heart rhythm disorders. Drugs like amiodarone, sotalol, and dofetilide. These medications affect the electrical signals in your heart, and magnesium also affects those same electrical signals. Combining them without medical supervision can lead to QT prolongation, a specific type of heart rhythm disturbance that can cause sudden, life-threatening arrhythmias. I'm not going to walk through a single case study for this one because the documented outcomes are too significant to reduce to one anecdote. What I will tell you is that emergency rooms see this combination cause serious problems more often than the public realizes, and almost every time, the patient had no idea their over-the-counter supplement was part of the problem. What to do instead? If you take digoxin or any heart rhythm medication, you absolutely must coordinate any magnesium supplementation with the prescribing physician. This is not a place for guessing. Your magnesium levels should be monitored regularly anyway if you're on these medications, and adding a supplement should be a deliberate medical decision, not a casual one. If you've made it this far and you're getting value from this, type the number 3 in the comments. It's a simple way to let me know you're here and following along. Before we move to the action steps, I want to mention a few honorable mentions, because they don't quite make the top 3, but deserve awareness. Certain antibiotics, particularly the fluoroquinolones, like ciprofloxacin and levofloxacin, and the tetracyclines like doxycycline, bind to magnesium in your gut. Take them at the same time as a magnesium supplement, and the antibiotic doesn't get absorbed properly. Your infection doesn't get treated. The fix is simple. Separate them by at least 2 to 4 hours, but most people don't know this. Certain osteoporosis medications, the bisphosphonates like alendronate and risdronate, have the same problem. Take them with magnesium, and the bone medication is essentially neutralized. And finally, some thyroid medications, particularly levothyroxine, can have their absorption blocked by magnesium taken too close to the same time. If you take thyroid medication, magnesium should be taken several hours apart. These aren't dangerous combinations the way the top 3 are, but they can quietly undermine the effectiveness of medications you're depending on. I promised you something you can actually use, so here it is. Every time you consider adding a supplement, especially after 60, especially if you're on prescription medications, I want you to have these 5 questions ready. Write them down, put them in your phone, bring them to every doctor appointment. Question 1. What is my current blood level of this mineral? Without a baseline, you're flying blind. A simple blood test can tell you whether you actually need supplementation or whether you're already in a healthy range. Question 2. How does this supplement interact with the specific medications I am currently taking? Your pharmacist is actually an excellent resource for this question, often better than a busy primary care doctor. Bring your full medication list, including supplements, and ask for a complete review. Question 3. What signs of toxicity should I watch for? For magnesium specifically, watch for unusual muscle weakness, slowed reflexes, fatigue that doesn't match your activity level, low blood pressure symptoms like dizziness when standing, nausea, and any change in heart rhythm or pulse. Question 4. How will my kidney function affect this supplement? If you have any reduced kidney function, and many adults over 60 do, without realizing it, your tolerance for minerals like magnesium changes. Your doctor needs to factor this in. Question 5. Could I get this from food instead? For most older adults, dietary sources of magnesium are gentler, harder to overdose on, and bring along other beneficial nutrients. Pumpkin seeds, spinach, almonds, black beans, avocados, dark chocolate, and whole grains are all excellent sources. Any good physician or pharmacist will welcome these questions. They will respect you more for asking them. And if your doctor dismisses these questions or makes you feel difficult for raising them, that is important information about whether that doctor is the right fit for you. I want to close with this. Magnesium is genuinely beneficial for many older adults. I am not telling you to throw out your bottle or assume the supplement industry is out to harm you. What I am telling you is that after 60, the rules change. Your kidneys handle minerals differently. Your medications interact differently. Your body absorbs and holds on to things differently. The casual approach to supplements that worked in your 40s does not work the same way in your 70s. And the difference between a supplement helping you and a supplement harming you often comes down to whether anyone bothered to check your blood work and review your medication list before you started. The best physicians I've ever known understand that the body is not a collection of separate systems. It's a network. And when you change one thing, even something as simple as adding a vitamin from the pharmacy shelf, you're changing the whole network. You deserve a doctor who treats your supplements with the same attention they treat your prescriptions, because to your body, there is no real difference. A molecule is a molecule. You have the right to know how your medications and supplements interact. You have the right to ask for blood work before starting something new. You have the right to insist that your full medication list, including the bottle of magnesium on your nightstand, be part of every conversation about your health. Medicine has given us incredible tools. Supplements can be part of a healthy life. But tools are only helpful when they're used in the right context, at the right time, for the right person. You are that person, and you deserve a healthcare experience that is built around your full picture, not around a single appointment or a single prescription. If this video gave you a new way to think about your supplements after 60, please subscribe. I make videos like this every week, practical, evidence-based, and honest, to help you take control of your health in the years that matter most. And leave a comment below. Have you ever started a supplement and noticed something change in how you felt afterward? Your experience might be exactly what someone else needs to hear before their next trip to the pharmacy. Take care of yourselves. I'll see you in the next one.